Hello, and thank you for inviting me to this conference. My name is Vamvakaris, and I'm a social research analyst for Healthcare Improvement Scotland Community Engagement, which is part of NHS Scotland. In this presentation, I will be talking about our National Citizens Panel for Health and Social Care, highlighting some of the key findings from the panel since the start of the pandemic. If you have any questions or want to find out more about the Citizens Panel or any of our other work, please feel free to get in touch. In this presentation, I will briefly provide some context around Healthcare Improvement Scotland and the Community Engagement Directorate. Then I will give a bit of background and context around our National Citizens Panel for Health and Social Care, and we'll go into some of the key findings from the panel since the start of the COVID-19 pandemic. So let's get into it. Healthcare Improvement Scotland is an organisation with many parts and one purpose: to support better quality health and social care for everyone in Scotland. Working with people at every level of the health and social care system, we make sure improvements in care are informed by the experiences of people who deliver services and people who use services. This slide highlights some of the key functions of Healthcare Improvement Scotland, such as providing advice on new medicines and health technologies, hosting global quality improvement webinars, and making the public voice count. As I mentioned, I am a social research analyst within the Community Engagement Directorate. In the Community Engagement Directorate, we believe people and communities should be able to use their skills and experience to design and improve the health and care services that matter most to them. Previously known as the Scottish Health Council, we started operating as Community Engagement and part of Healthcare Improvement Scotland in April 2020. We have a Scotland-wide presence, with a network of staff across Scotland with expertise in community engagement, supporting and advising health boards on best practice for engaging with individuals and communities to shape local services and influence national policy. We have 14 engagement offices, one in each territorial health board area. We run the Volunteering in NHS Scotland programme, and our teams include the Public Involvement Unit, the Participation Network team, in which I am in, and our Service Change team. Now that I've provided a bit of context around Healthcare Improvement Scotland and our work, let's look at our Citizens Panel. A Citizens Panel is a large representative group of a population, usually around 1,000 people, that are randomly selected, and they tend to be used for quantitative surveys. This shouldn't be confused with the Citizens Jury, which is a small deliberative group of between 18 to 25 people, nor a Citizens Assembly, which is usually around 100 people. Our Citizens Panel was established in 2016 to gather a public view on topics around health and social care. The aim was for the panel to be nationally representative and has been developed at a size that allows statistically robust analysis of the views of panel members at a Scotland-wide level. This was the first time a national citizens panel of this nature, focusing on health and social care issues, has been established in Scotland. The panel was established using stratified random sampling through the electoral register. So panel members were randomly selected from the general population and invited to join the panel. Some targeted recruitment also took place to ensure that a representative panel was created, for example targeting specific demographics such as younger people or ethnic minorities. There are currently 953 panel members from across all 32 local authority areas in Scotland. The panel is broadly representative at national level across Scotland in a range of demographics, including sex, age and deprivation. The panel is refreshed from time to time to ensure representativeness, so some people are asked to step down and new members added on. We aim for the data from the surveys to be accurate to plus or minus 5% at the overall panel level, with response rates typically over 50%. We collect data from the panel members via electronic survey, postal survey and telephone interviews according to the panel members' preference, ensuring that our methods are as inclusive and accessible as possible. Using these methods was even more important during the pandemic, as other methods of engagement or data collection, such as in-person focus groups, could not be used. This enabled our Citizens Panel to continue business as usual and inform decision-making throughout and beyond the pandemic. The panel focuses on topics of national interest that the general public can give feedback on, for example access to dentistry services or eye care. Topics tend to come from Scottish Government, with which we work in close collaboration with, ensuring that we look at timely topics that are a national priority. We run 2 panel surveys per year, and we maintain panel members' engagement through providing feedback on the panel's impact. In the panel surveys, we mainly used closed questions with a few open questions, collecting both quantitative and qualitative data. We develop the questions with policy teams and user test them with members of the public. The fieldwork is done typically within 15 weeks, facilitated by our research contractor's research resource. All Citizens Panel reports are published on our website at the link on this slide, and we usually present key findings at webinars or events much like this. The reports now also include recommendations, which highlight and support the impact of the Citizens Panel findings, leading to tangible implications and change. These recommendations are developed alongside policy leads and our collaborators in the Scottish Government, who have highlighted they found the process very helpful to explore how the findings can inform their work and have an impact. The Citizens Panel has covered around 30 topics since 2016 to establish a public view on health and social care. Some of these topics have included social isolation, digital healthcare, and shared decision-making. More recently, we collected feedback on the recovery and mobilisation of dentistry services and urgent and planned care, as well as public views on COVID-19 vaccination inclusion and COVID passports. So as you see, the panel has focused on quite a broad spectrum of topics, and we've tried to ensure that topics are current and relevant to the general public, so most panel members will have some understanding of the topic. The work of the panel doesn't end with the publication of survey findings. When we accept a topic commission, there is an agreement with topic sponsors that they will provide feedback about the usefulness and impact of survey findings, indicating how they have used these to shape, inform, and improve their work. This practical use is a core function of the Citizens Panel. Previous surveys have gone on to inform a range of policy developments and service improvements, such as those listed on the slide. The panel has had really significant impact so far in health and social care policy and practice in Scotland. In fact, we have had very positive feedback recently from the Office of the Cabinet Secretary for Health and Social Care. Mr. Yousaf noted that this is very valuable feedback and officials will want to consider the results of the Citizens Panel in terms of further policy development. Now let's go through some of the recent Citizens Panel findings since the start of the pandemic. In summer 2020, we were asked by Scottish Government to engage with the public for input into critical decisions on resuming and supporting service provisions in the context of the COVID-19 pandemic and beyond. The aim was to engage widely with people in Scotland and ensure a person-centred focus in service remobilisation, recovery and redesign. For this purpose, we used the Citizens Panel. During November and December 2020, as case numbers were increasing and social restrictions were tightening again, we asked questions focusing on people's experiences of health and social care since the start of the COVID-19 pandemic. Based on a 56% response rate, these are some of the key findings from the Citizens Panel 7 report, which is available on our website. The majority of panel members said that their health and well-being has remained about the same since the COVID-19 restrictions began in March 2020. On the other hand, 29% of respondents said their health and well-being had got worse, which is around 4 times more than the proportion of respondents who felt their health and well-being had got improved. And women were more likely to say that their health had got worse than men. The top priority for panel members was access to routine appointments, followed by better access to GP services and shorter waiting times. Just under 2/3 of respondents had accessed or tried to access health and social care services since the pandemic started in March 2020, and the majority had tried to access their GP. Women were more likely to have accessed or tried to access services than men, and just under half of all respondents said that they had difficulties accessing services. In terms of community support, 1 in 5 respondents said that their health and well-being had been supported by the community since the COVID-19 pandemic started in March 2020. This support was most likely to be having someone to chat with, or receiving help with shopping or collecting a prescription. Those over 65 were more likely to have stated that they received support by the community. Furthermore, over half of the respondents had seen no change in the strength of their community since the COVID-19 pandemic started in March 2020. However, 36% felt their community had strengthened, but on the other hand, respondents from the most deprived communities were more likely to say that their community had weakened. The findings from the panel survey were an important addition to the body of evidence on the widespread and serious impact of COVID-19 on people's experience of health and social care. Key themes from the findings, such as the need for a person-centred approach to service design and delivery, were used by Scottish Government to develop the mission, objectives and work programme for the Care and Wellbeing portfolio. A larger proportion of respondents said their health and wellbeing had got worse than improved since March 2020, and this was more likely for women. Thought should therefore be given to supporting women to access services, particularly in deprived areas where the survey shows community support has weakened to a greater extent. There is evidence that availability and access to health and social care plays a large part in people's health and well-being, so consideration should be given to how services communicate and engage with the public to improve access. The findings also highlighted the pandemic's impact on people's general mental health, as well as the impact of loneliness, particularly for the elderly. The importance of community support was also highlighted. However, it is important to note that over twice as many respondents from the most deprived communities stated that their community had got weaker than average. This should be considered in future planning going forward. And we have continued to use the Citizens Panel to support the mobilisation and recovery of services following the pandemic. In November 2021, we asked the Citizens Panel about dentistry, urgent care and planned care. Based on a response rate of 63%, these are some of the key findings on dentistry. Most respondents said that they feel they will be able to access the dental services they want over the next year. However, only 18% said they thought that would be within the normal time frame, whilst the other 66% said they believed it would be under certain circumstances, such as those highlighted on the slide. When thinking about priorities for visiting the dentist, being able to get access to treatment when needed was most important, followed by getting regular checkups. The most common barrier to visiting the dentist was the potential cost of dental treatment, followed by difficulty in getting an appointment and anxiety about visiting the dentist. However, over 1/4 of respondents said that nothing stops them from visiting their dentist. If you'd like to read more on the Citizens Panel 8 findings, you can find the full report and recommendations on our website, and I have a link to that at the end of the presentation. In January 2022, we asked the panel about COVID-19 vaccination inclusion, COVID status certification, also known as COVID passports, and public engagement in health and social care. Based on a 53% response rate, these are some key findings on public views around COVID-19 vaccination inclusion. The most common sources of information the panel members used to help them decide whether or not to get vaccinated were advice from senior health officials, discussions in the media such as TV, radio, online news websites, and discussions with family or friends. With respect to formal NHS information sources, many had used the NHS Inform website and a COVID-19 vaccination leaflet. Overall, 89% of respondents stated that they think the COVID-19 vaccination programme in Scotland was either very accessible or somewhat accessible, compared to just 3% who believed it to be either somewhat inaccessible or not accessible at all. Most found the online booking system and the National Vaccination Helpline easy to use. Those who had been vaccinated were asked how accessible or inaccessible they found different aspects of their COVID-19 vaccination. Most respondents found all aspects around COVID-19 vaccination accessible. Aspects that were most likely to be accessible were vaccination venue accessibility features, information around vaccination, location of the venue and getting to the venue. The highest proportion of respondents stating an aspect of the vaccination programme was not accessible or was slightly inaccessible was 8%, which was noted for both the process of vaccination, for example queuing or length of wait, and travel to the vaccination venue. These most recent findings are being considered by Scottish Government and decision makers at a national and local level, informing future policy and practice. For example, panel findings on planned care are informing the review of waiting times guidance, and the findings on COVID-19 vaccination and COVID passports are being considered in regards to future vaccination programmes and similar future major health interventions. In summary, the Citizens Panel is a large group of people representative of the Scottish population, which we use to collect views and feedback from the public on health and social care. Using the Citizens Panel to collect public views and input into critical decisions about service mobilisation and recovery was and will continue to be essential during and following the pandemic. This method allowed for timely and representative feedback from across Scotland, supporting a greater understanding of people's experiences during the pandemic, and ensuring they inform future planning even at the most challenging of times. I hope you found this presentation interesting. If you would like to read more about the Citizens Panel findings, you can find all reports on our website at the link on the slide. And if you have any questions, please add them here and we'll get to them as soon as possible, or get in touch via email. Thank you for listening, and I hope you enjoy the rest of the conference.